Administering medications for IV piggyback. I'm first looking at the doctor's order in the MAR, and I see that doctor has ordered for John Smith 250 milligrams of Flagyl at 50 ml in 0.9% normal saline. To calculate the correct dose, it's 27 drops per minute or 7 drops per 15 seconds. And so I've calculated that, and that is the first check. And then I'm going to look it up in the drug book and make sure that they are compatible, the normal saline and Flagyl, which they are. So then in the patient's room, I'm looking at the patient's ID bracelet and checking name and date of birth and allergy. So that's step 2, and then assessing the patient. Step 3 is with the MAR. I've done hand hygiene. I've got my equipment, and I've checked to make sure that they are both the piggyback IV of the 50 mLs of normal saline and the secondary IV tubing, which is 10 drops per milliliter. They're both intact and not punctured and not expired. So then I can take out the saline with the medication, and first I'm going to I've done hand hygiene, and so in a sterile manner I'm going to uncap both the spike and the cap on the saline and connect the two. Okay, and then I'm going to just prime it. So I'm just going to hold it and fill it to 1/2, and I'm going to just slightly over this bucket, just look and see. Yep, okay. And so, yep, it's the water's come through. Okay, so this is primed and tapped it for bubbles. So this is ready to go. And so then I'm going to lower the primary for gravity IV bag. Oops. And then I'm going to attach the secondary, the piggyback. Okay, and then I'm going to, with alcohol, I'm going to wipe off the port that is the Y port that is the closest to the primary drip chamber, and making sure everything is down. And sterilely, I'm going to lower lock them together. Okay. And then I'm going to, having this down, I'm going to open the piggyback clamp to the top. Then I have my second hand, and I'm going to slowly open and count until I get to 7 drops per 15 seconds. Okay, let's see. Okay, I've got it. And so now I'll show you. Okay, and that's for demo purposes, so I'm going to go ahead and shut that down. And then I'm monitoring the patient for any allergic reaction to the medication. And I'm documenting in the MAR and the INO record the medication, the amount that I gave, and the time that I gave it. And then I'm going to return the flow rate to the original 125 milliliters per hour of the normal saline after this has gone through, and that's the 8 drops per 15 seconds. So then the next thing I'm going to do is I'm going to do an IV push. Checking the physician's order with the MAR, and I can see that doctors ordered a one-time 25 milligrams of Benadryl, and it comes in stock as 50 milligrams and 2 mLs. So I'm going to be giving 1 ml, and I'm going to prepare the injection with the 3 checks and the 6 rights, and verifying that in the drug book that the Benadryl is compatible with normal saline 0.9%, which it is compatible. So I've done hand hygiene and prepared the medication syringe, and then using the existing line, I will, if they were not compatible, I would either set up a new catheter line in a different spot. If that's not an option, then I'm preparing also 10 to 20 milliliters of saline into the existing line, which is going to be the Y port that's closest to the patient. And I'm going to wipe the port with alcohol, and I'm going to push the saline flush, and then wipe the port with alcohol and put the 1 ml of Benadryl, and then wipe with a new alcohol wipe again, and then put the next saline push of the 10 to 20 milliliters. And then most hospitals don't do a heparin push, but if my location required it, I would give heparin push after the second saline. And it would be the same amount as the medication. So again, I'm wiping with alcohol and then pushing the heparin. Ways to make sure that the line is patent is to make sure that it is open and that there's no clot. And then also want to check for phlebitis at the site. So looking for any inflammation or redness or pain or other symptoms, and then if everything is good, then it's patent and it's okay to go. So then since we don't have, since everything is compatible, I would wipe the Y port closest to the patient with alcohol, and then I'm clamping above it, and then I'm going to, so that's antigrade, and then I would give the medication, and then I would pull it out, drop the line, take out the injection, whether it was needle or needleless, and then I would, I'm checking for any adverse reaction and putting into the MAR and the INO report, the medication, and the dose, which was the 25 milligrams of Benadryl and 1 ml, and the time. And then I'm going to check the flow rate to make sure that it's correct as was before, which was 125 milligrams per hour, or the 8 drops per 15 seconds.